Did you know that over time, poor posture can change the anatomical structure of your spine? Just like a young sapling, correct support and bracing provides opportunity for strong trunk growth. But what does poor posture look like? And if you have it, what can be done with it? Chiropractic care is your best solution. We are excited to be talking with Dr. Jit again, our head chiropractor at Body Works Pickering. Dr. Jit, can a chiropractor fix posture?
Simple answer, absolutely, yes. Now, there are different factors that we have to take into consideration when we're talking about posture. So the two main types are anatomical, as you mentioned, versus functional. So in the case of the anatomical, something in the anatomy of that individual is causing the muscles, the bones, everything to kind of shift or deviate into one direction. So this is typically one of those things that we would have the patient still come in. We'll go through a brief assessment. We'll kind of discuss different things about, factors about what they do for a living. We'll look at different things that they do throughout the day, their hobbies, everything that they kind of like to do in order to see what they're doing with movement and how their body moves. And typically at this time, we might kind of make some suggestions in terms of some devices that they may or may not be beneficial for them, which sometimes could be something simple as an elastic band that will kind of keep their shoulders back like this, because they're often sitting down at work at a workstation all day long. Or it could be something like a foam roller, which again, that they're able to kind of roll their back over in order to kind of help reverse that hyperkyphosis, which kind of develops when you have that hunchback. But outside of the anatomical, unless if there's like a really bad scoliosis, which might require some surgical bracing, and that would be a completely different medical route that they would have to go through for that. There are functional problems with posture. So a functional posture problem would be something where I type on my computer all day long, so I'm going to look like this, and you're going to kind of see that my shoulders have rounded forward, my head has come anterior, and if I turn to the side, you'll see that I've already started to hunch my back. So a lot of the muscles on the front part of my body have now begun to get really tight because our bodies are very lazy. So it's a very constant tug of war that our body has with the muscles on the front side and the back side in this case. So the ones on the front get really tight and then they get stuck and they stay there. So this is where we would kind of address it via the chiropractic, the physio, or the massage therapy route. So what I would personally do is maybe work on some adjustments for the cervical and the thoracic spine in this case to kind of help increase the movement and restore some of that function. The massage therapist at Body Works might be able to kind of work on some of these tight muscles. So you have some really tight pecs, they can do some massage techniques for those areas. And then also on the opposite side of things, when the certain muscles are tight and they're constantly pulling on the front side, the muscles on the back get weakened. So we might be able to kind of refer to physiotherapy in order to strengthen those muscles on the back to kind of even out that tug of war where the muscles on the front are really big and strong and the ones on the back are weak, that it's going to kind of pull it this way. But with that physio, we're able to kind of help balance or strengthen those both out.
All right, so Dr. Jit, with the information you've given us today, what's the next step for anyone looking to book in with an excellent family chiropractor for some posture care?
Yeah, perfect. So the best way is to check us out at our website, www.bodyworksphysio.ca, or call us at 1-866-7-PHYSIO today to set up your appointment with one of our Body Works therapists. Yeah.
Awesome. Thanks, Dr. Jit.